Hi, I'm Suryo Linda Gardner. I have a master's in clinical psychology, and I'm a certified body talk practitioner and instructor. With a positive diagnosis for HPV, what I see the origins are there's a lot of psychological issues around boundaries, around sexuality. Often a woman is not clear on her own sexuality. There's often psychological trauma, and of course there's virus. When a woman comes in with an HPV virus diagnosis, she can look at from possibly 2 to 5 sessions of, typically I work with body talk system, energy psychology, which includes a lot of tapping. So it depends upon a lot on the trauma that this woman has experienced. But we basically work from a perspective of looking at what are the psychological issues, what are the blocks, what are the beliefs, the limiting beliefs, a lot of simply put self-hatred, a lot of sexual trauma, a lot of boundary issues. And when those are rebalanced, in our language of body talk, when they're rebalanced, then that person's system heals on its own. And it takes probably, well, one woman healed in 1 session, but that's not typical. It takes probably about 5 to 6 sessions. The treatment for working with HPV, specifically more psychologically as well, when I use the body talk system, it's actually very unique in that if there is psychological trauma, if there is sexual trauma or boundary issues, we may work with emotional balancing, but we're also going to work, there's tapping techniques. So we're doing, well, I could show you, there's tapping techniques that we do to basically neutralize the charge on the trauma. Now the trauma is going to be stored in the body, in the fascia. So there's going to be fascial balancing, that's one aspect of it. The belief that they have incorporated with this trauma is going to be held at the cellular membrane. So that's one aspect of it. And then there are a lot of other issues that are going to connect up with the amygdala complex in the brain, and then biochemical issues that we deal with from a body chemistry perspective. So there's a lot of looking through the whole system at all levels of consciousness, which is really amazing because it's not just a virus. There's a lot of psychology involved. There's a lot of repair that has to happen within the connective tissue, within the psychology. And also a lot of it can come genetically, that they can have trauma that goes back generations and generations, especially along the matriarchal lineage. A woman right now who has this diagnosis can begin to empower herself by working with, she can start with journaling. That's a really good thing to just bring up to consciousness what's been held down in there, in the virus. She can look at her lineage if she knows it. You know, what happened to, more specifically, her grandmother. Often it skips a generation. These issues often skip generations. She can also do a technique to help balance the body that I teach that is called cortices. And another thing is to come in for sessions so that she can start clearing this, rebalancing it so that it can neutralize in her body. I have seen women who literally neutralize this in a few sessions. They go back to their gynecologist and they're tested as negative. So it really works.